This is the National Report for Wednesday, September 15th, 2021. In the headlines, Senate passes supplementary appropriation bill allowing for greater focus on capital investment. Details to this story and more in the National Report. Details to the news. I am Leslie Ann Johnson. Senate on Wednesday passed the Supplementary Appropriation Bill 2021, which approves an additional $54 million that will help the government of Grenada to respond to the health, social, and economic impact of the COVID-19 pandemic. The $54,910,146 for the fiscal year January 1st to December 31st, 2021 is an addition to the 2020-2021 budget of over $1 billion. The bill was brought before the House by Leader of Government Business, Senator Simon Steele, who pointed out that government must employ additional measures to safeguard the economy. Total revenues and grants for the first half of this year are behind the target by just over $31 million. And during that same period, government spent in excess of $60 million more than it collected in local revenues and grants to meet obligations, including paying salaries on time and paying the 4% increase for public workers. However, Senator Steele says they are still projecting positive growth at the end of this year, although slower than originally projected. He added that the economy is now expected to grow by 5.2%, and some of the interventions in the supplementary budget will contribute to this growth.
These are additional resources that are being brought into the Treasury on top of the resources that have already been allocated, spent throughout the course of the year. As I said in the opening, the focus of this appropriation bill is on the capital side. These are activities that are either protecting or creating jobs, contributing to the growth of the economy, and addressing the specific needs at this time as we navigate our path through this pandemic.
More than 95% of the bill is geared towards capital investment. Giving his support to the bill, Minister for Infrastructure Development, Transport and Implementation, Senator Nolan Cox, says investing on the capital side of the budget creates significant economic activities through products and services, which lead to revenue generation. He's confident that with all involved, Grenada will eventually win this battle.
I believe that where we are as a government in terms of the COVID response, and I've always said in this honorable house, that our response to COVID, based on our definition of response, has never been a government response. It has always been a national response. It has always been the government of Grenada together with the people of Grenada in the response. Because we can only make recommendations, but their participation and support and adhering to those recommendations for the greater part is what will bring us success, what have brought us some measure at some point in time until now. But I say this, that despite whatever challenges that we have, we are certain as government that we will get over this with the support of the majority of this nation to go past this and to ensure that we return to some semblance of normalcy and to realize the true Grenadian spirit through this difficult period in our country's history. We have had several, Mr. Deputy President, and we have come out of those. But we have come out of those as a country, never as a government. Hence the reason why our approach and our definition of this is a national response.
While there is a steady increase in the number of COVID-19 cases in Grenada every day, the Ministry of Health is heartened by the number of recoveries that are also being recorded. Tuesday's statistics from the ministry indicate that Grenada has 641 recoveries of the total confirmed cases, which stand at 2,740. 67 people remain hospitalized, according to the latest reports, while 2,061 are in isolation. With Grenada having transitioned to community spread, only 8 of the current total of 2,061 active cases are imported, while 2,053 are local cases. There are 43 cumulative deaths. 5 more people died on Wednesday, 3 at the General Hospital, 1 at the Princess Alice Hospital, and the other is what is referred to as a community death, meaning the individual died at home. With many of the tested samples confirming the Delta variant in Grenada, Chief Medical Officer Dr. Sean Charles said the pandemic has blindsided many people, but he believes working together we can overcome what he refers to as a national crisis.
The enemy that we are dealing with is formidable. This is the Delta variant, and it is the same Delta variant that has devastated many parts of the world. It is very contagious, very deadly, as is evidenced by what is happening here locally. The thing is, why I said that many of us may have been blindsided, is that this is our really first true wave. While there are many countries that are on their third or on their fourth, this is our really first true wave. And it did not hold back its punches. It hit us with everything.
Warning signs of COVID-19 include persistent chest pain, difficulty breathing, dehydration, changes in skin color, and difficulty in waking. Those who are most at risk include the elderly, those with chronic underlying diseases, cancer, kidney disease, chronic lung problems like asthma, as well as those living with diabetes, hypertension, and heart problems. Even when faced with a limited space and crowded households, health officials are encouraging people to still follow the isolation protocols. Medical officer in the Ministry of Health, Dr. Mayana Charles, said although it may be difficult for those residing in 1 or 2-bedroom dwellings, it is not impossible to manage a confirmed COVID-19 case in the household. She said that a separate space should be allocated for the COVID-19 positive individual.
I just want to provide some practical tips that person can follow when in home isolation. The first thing, if there is someone in your household that has been diagnosed with COVID-19, right, I encourage person to identify another member of the household to be the caregiver for that person. And while providing care, I encourage that individual to practice all the relevant measures. That person providing care should wear their mask at all times when doing so. And even the person diagnosed should also be wearing their mask. They should sanitize their hands and surfaces frequently after interaction with the case. When practical, prepare a separate home or a separate room in the household so that the case can isolate and be separated from the persons who are not sick. Additionally, open a window or open all the windows to improve the ventilation in the household, right? If you do have a case in that household. And I want to urge again, everyone in that household should wear their mask at all times to prevent further exposure. As Dr. Sean Charles mentioned, we need to break the chain of transmission.
The government of Grenada has declared September 25th and 26th as National Days for Spiritual Reflection in recognition of the critical role of spirituality in dealing with the impact of the COVID-19 pandemic. Government is therefore encouraging all religious and community leaders to unite and organize special virtual activities for those days. Minister for Religious Affairs, the Honorable Emmeline Pierre, said government recognizes the extremely important role of the religious community in offering spiritual leadership and care to the nation as it faces the challenges associated with managing the spread of COVID-19. All Grenadians, including those in the diaspora, are encouraged to go before God as a nation in reflection and prayer during the designated days of spiritual reflection. Government solicits the support of all stakeholders, including media houses, in promoting the days and helping to create the appropriate atmosphere. The Religious Affairs Minister also continues to encourage all Grenadians to follow the COVID-19 protocols, get vaccinated, and remain safe. This is the National Report. More news after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. The Ministry of Health is appealing to private practitioners in Grenada to assist with serving the Grenadian public who are seeking assistance via the COVID-19 hotline. The ministry has significantly boosted the number of volunteers manning the lines, but this is still insufficient, resulting in many calls going unanswered and creating a serious concern for Minister for Health, the Honourable Nicholas Steele. During Tuesday's post-cabinet briefing, Minister Steele reiterated that all must be involved in the fight against the virus and it should not be left to the government alone.
Grenada has one of the highest percentages of doctors, ratio of doctors to the population than any other country in CARICOM. One of the highest percentages. Majority of these doctors are in the private sector. We're not seeing a flood of them coming forward to volunteer on a simple hotline to take questions, and we need them. It is time that our private practitioners also step forward and not leave the dealing of this pandemic purely to the public doctors who are serving the nation. They too need to step forward simply to volunteer on the hotlines, to help us triage, to help inform people of what to do. Because people are calling, yes. And yes, right now we're up to about 70% of the calls we're able to answer. That's 30% of the calls that we're not. And we need our doctors on that hotline. We have our district medical officers and we have our government doctors on. We need some more private sector doctors on those lines.
The ministry has been adding volunteers on a daily basis to assist with the flood of requests on the hotline. The latest count is more than 60, and others are coming forward daily, but more help is needed to provide timely assistance to those seeking help. Given the current COVID-19 situation, the Central Statistical Office is unable to start the enumeration for the 2020 National Population and Housing Census on September 15, 2021, as originally scheduled. The office has tentatively rescheduled the start date to October 15, 2021. However, this date is subject to change if the COVID-19 situation worsens. The Central Statistical Office will be guided by the advice of the Ministry of Health and the prevailing emergency powers regulations. And finally, Prime Minister and Minister for National Security, Dr. of the Right Honourable Keith Mitchell, has extended condolences to the family of the late Assistant Superintendent of Police Byron Klein, who passed away on Wednesday morning. Dr. Mitchell has also extended condolences to the Commissioner of Police, Edwin Martin, and the rank and file of the Royal Grenada Police Force. ASP Klein joined the RGPF on January 19, 1985, serving for 36 years in various capacities. At the time of his passing, ASP Klein was second in charge of the Central Division of the RGPF. The Commissioner of Police, gazetted officers, rank and file of the force also extended their deep condolences to the family, friends and colleagues as they come to terms with this loss. Following his death, the Commissioner of Police ordered that all police flags be flown at half-mast. And that's the National Report. I'm Leslie Ann Johnson.